Hi, thank you for being here with me today. My name is Dr. Allison Felt. I am the owner of Body Motion Physical Therapy, and we have locations in Poulsbo and in Edmonds, Washington. We specialize in helping people through pregnancy, fertility, birth prep, and postpartum recovery, all the way through menopause, so they can live active, healthy, and confident lives and avoid things like pills, surgery, and all of the stuff that comes with aging. So take care of our bodies. That's what we do. We teach, preach, and we are so happy that you're with us today to learn the secret to decreasing your push time and preparing your pelvic floor for birth. This should also say preventing prolapse, improving your ability to get back to exercise without any issues postpartum. So taking the time to do all of this now, learn this for your body, is absolutely essential in having a great birth, but also in the years after your birth, not having issues creep up like incontinence, constipation, all the fun stuff that people think is normal with childbirth. And after you've had kids, how many people joke about peeing their pants when they go to the trampoline park with their kids. It might be a funny thing to laugh off, but at the end of the day, that means that our pelvic floors aren't working for us. Our cores, our deep cores aren't working for us. And a huge passion of mine is helping people prepare for childbirth so they can avoid those consequences of really their cores and their bladders not being in the right place in the years to come. So thank you for being here, and we will get started. All right, so with me today is Dr. Riley and Devin, our operations manager. Dr. Riley is the director of the Poulsbo Clinic, and we are excited to meet you and be here today. These are just a few things that our clients that prep for birth, that prep their pelvic floors and their whole body for birth. This is a few things that they say. I absolutely love these, and I am going to share them. I will read them out loud. I breathed my baby out, and there she was, like out, amazing and perfect. No tearing, no nothing, and still felt it, but like in a good way. Here's what another client said. Water broke at 8 p.m., got to the hospital at 9:15. I was 3 centimeters when I arrived. Contractions were about 1 minute apart by 10:30. She was 5 centimeters by 11 p.m., had absolutely intense contractions the whole time, decided to get an epidural, but pressure was nonstop. Seriously breathed him down so quickly, I could feel it. It was what she said. Pushed for a total of 6 minutes. He was out quick with zero tearing. Big, healthy boy, so much hair. He's sleeping, going to try to rest now. Love you and so grateful for your clinic. Had the breathing in my head, and just wow, 4.5 total hours from water break to baby. The next client said, they were impressed with my pelvic floor. She's talking about the providers. Only pushed for 45 minutes and had a really small first degree tear that they debated not stitching, but ended up doing it. Another client started contractions on Easter, went to the hospital the next day, sent her home, came back to the hospital 1.5 hours later, stayed and got an epidural, was 4 to 5 centimeters dilated through the night, worked on visualization and breathing baby down in the morning, was feeling nauseous, and she threw up and ended up giving birth during that vomit session. So without the provider in the room, actually. So she healed in 2 to 3 days, no pain or leakage or heaviness after this birth, which is a complete opposite of what she had after her first birth. So she said, thankful for pregnancy pelvic PT and healing so much quicker. I have one final story, and I just think these stories are so absolutely empowering, which is why I share them with you, because truly we can have such great births if we just prepare our bodies. Obviously, there are certain things that happen that we don't have control over, but if you know what you can control and you know how to control your breath and you know how to control your pelvic floor, you end up having so much more power in your body. So another woman here, I started having contractions early yesterday morning. I had an appointment at 1 p.m. with my midwife at the birth center. She said she wasn't quite ready to admit me. So we left, walked around the Totem Lake area, met my doula at the birth center at 3:30, Walk the stairs for 30 minutes. By 4 p.m., I was having a harder time getting through the contractions. 4:45, I was feeling the urge to push. And my midwife said she could break my water. My mom hadn't gotten there yet, so we called her to come. She got there at 5:30. My water broke on its own at 5:48, and baby was born at 6:02. So fast and so intense, I did not tear even a little bit. Water birth maybe helped, but I truly believe it was all the prep work that I was doing at your clinic. Thank you for what you ladies do. I wouldn't have had this experience without you. So grateful and blessed. So these are some magical stories, and this is just a little teeny piece of what we get to experience every single day and be a part of your journeys. I got into this because I'm a mom of 3. My first 2 births were a lot of pushing and not ideal. I also prepped like kind of the standard way as a pelvic floor PT. I was a pelvic floor PT for the first 2 births too. And really the standard mold for pelvic floor PT is like, okay, yes, learn how to relax your pelvic floor, maybe do some external work, do some biofeedback. And I really came to see in my own births, but then also in my 13 years of clinical practice, that was not working to help prevent vaginal tearing. That was not working to prevent hours and hours of pushing. And that was not helping decrease the C-section rate in America. So that's when these body motion protocols that we use for birth prep, they are not your standard physical therapy pregnancy support. We're talking about specific protocols that we use and methods we use to help prep for birth. And we're going to give you some of those today. And these are truly what are changing push times. We'll talk a little bit about anatomy, some core posture and body mechanics. Then we'll get into the real reason you're here, which is the pelvic floor prep. And we'll talk about some daily rituals to prevent tearing, how to push, normal postpartum healing times, and exercises that you can do during your pregnancy and postpartum. So we'll get started. The reason I bring up the anatomy and some posture things is because all of this affects your pelvic floor. And so it's important to know how to best manage your posture and different body mechanics to help prevent other injuries like diastasis recti, pubic bone pain, or SI joint pain, which is like low back pain on one side. It's really important that we talk about these things, because if we can help prevent those issues from creeping up, then your pelvic floor won't be as tight and contracted and not optimal position for birth. So we want to keep your body as healthy as possible so your pelvic floor can be in a relaxed position, and then you can train your pelvic floor for birth in that relaxed position. So a few things. During pregnancy, your body changes. From the progesterone, the relaxin, the estrogen, all of these hormones are helping increase the laxity of our ligaments, meaning that we get more flexible in our ligaments. They're pretty much predominantly affecting the pelvic ligaments, but they affect all the ligaments in their body. Their specificity isn't that good that it's just the pelvis. So they're affecting the joints of the whole body. So maintaining optimal posture is really important. So here's a few things. So during pregnancy, as your head goes forward, one thing that you could think of and you want to start to do is to so as your head goes forward, you want to start to bring your head back over your body. Imagine like someone's taking your ponytail, if you had a ponytail, and pulling it up to the sky. You almost give yourself a little bit of a double chin, and that's good. We want that. That's good positioning. And then our shoulders will tend to go forward during pregnancy. We want to work on bringing them back down. So if we had a shoulder blade here, you want to think about reaching that into the back pocket, like if you had jeans on, into the back pocket here, and same thing on the other side, into the back pocket, and your sternum pops up a little bit. When that happens, you want to make sure that you're not just like dumping forward. You want to pull baby in, activating what we call your transverse abdominis. So if you imagine like you're trying to lift the baby up with your muscles, you're activating your transverse abdominis. Another way to look at this is if you can't quite grasp that analogy, you can try to imagine if you were trying to put on a tight pair of pants or buckle something really tight, you kind of pull up and in to pull baby in, or to pull your belly in to get that buckled. So that is the first action to help drive that transverse abdominis contraction. And then just from the knees perspective, we want to make sure we're not locking our knees out so they're hyper extended or really, really straight. You want to keep a soft bend in your knees. Having about 2 fist widths between your knees and your feet when you're sitting is going to be really good posture. Not crossing our legs is going to be really important for supporting the skeleton itself. So this is a really hefty slide. You don't have to read all of it. We're going to talk just briefly about it. But as you grow the baby, your muscles get longer and therefore they get weaker because they lose what we call this length tension relationship. They also predisposes us to like getting an ab separation, right? So diastasis recti. Um, the way to help prevent that is by learning how to activate that transverse abdominis. So one daily ritual you can start to do is contract that muscle for about 10 seconds, 10 times a day. 10 seconds, 10 times, at least once or twice a day. And that just keeps that muscle active and supportive. And so that is important as we talk about preparing our bodies for birth and really making sure we're keeping our core strong. Now, from a diaphragm perspective, our diaphragm lives under our rib cage. So our rib cage right here, it expands as we grow a baby. And sometimes people will get rib pain, and we can absolutely help with that. But the diaphragm that is living under your rib cage, that expansion then becomes weaker. So you got to keep training this muscle all the time in order to keep it strong. This is going to be one of the best and important muscles to help you get the baby out of your body. This is going to help you avoid the purple pushing or breath holding when you're pushing. The breath holding when we're pushing does increase the amount of tearing and damage within the pelvic floor itself. So that's why we really go with trying to teach you how to control your pelvic floor with your breath during pregnancy in order to help optimize and be able to breathe the baby out of your body. I'll give you some tips later on as we go. The very first thing though, let's go into a diaphragmatic breath together. So when I teach this, I usually say put one hand on your chest, one hand on your belly. Take a deep breath into your belly and let it go. Imagine this hand on the chest is not lifting or changing, and try to allow that air to go all the way into the hand in the belly and let it go. You can also think if your rib cage, if there was an umbrella under the rib cage and you are trying to like an upside down umbrella and you are trying to expand that umbrella in a 360-degree manner, you are expanding that umbrella with your inhale. So you inhale, you get some into the ribs, a lot into the belly, and let it go. Okay, so 5 minutes a day of that type of breathing. Learn that type of breathing. Now you might be sitting here thinking that's the complete opposite of pulling the baby in that you just told us to do. And these are different exercises. So definitely the tummy contraction, pulling baby in, is going to be important for keeping the transverse abdominis strong. I'm going to show you a picture of that on the next slide. The diaphragm is going to be really important for breathing this baby out. So we just went through the breathing. We're going to go through it more in the following slides. Some other changes I want you to know about. So here is my handy dandy pelvis. This is the front of the pelvis. This is the back of the pelvis. The front of the pelvis has what we call here a pubic symphysis, or it has this cartilage, pubic symphysis. It's between the two pubic bones. Some people get pubic symphysis dysfunction or pubic bone pain, or symphysis pubis, called a multitude of things. During your pregnancy, this joint separates 5 to 7 millimeters, all right? In delivery, it can stretch all the way up to 9 millimeters. Well, because this is happening slowly over time, reactively and clinically, what we see is the pelvic floor contracts and squeezes during our pregnancies to help hold our pelvic joints together, okay? So yes, that's great for, keeping everything as stable as possible, but it's not so good in preparing for birth when we want this muscle to be able to overstretch, okay? So it's really important that we talk about learning how to elongate the pelvic floor muscles instead of constantly tightening them. This is why I'm very much of the approach during pregnancy is we have to learn to relax the pelvic floor, because if we can get the pelvic floor fully relaxed, every step you take in your daily life is actually causing a Kegel or causing a pelvic floor contraction. So you don't have to just think volitionally, I need to do 10 to 20 Kegels a day. Yes, that is what some of the research says. But anyone who practices clinically and sees pelvic floors during pregnancy knows that these pelvic floors tend to be very tight. So if you are pregnant, I highly recommend getting an evaluation by someone who treats pregnant clients every single day. So they know exactly what pelvic floors of pregnant women should, or birthing people should feel like, because it's so important to be able to overstretch these muscles and train these muscles for birth. And if you're walking around really tight, like in a contracted muscle, it's going to be hard to get the baby through that. So yes, we can teach you how to relax, but a lot of the time we need overstretching for the baby to be able to get out of the pelvic floor without damage and without pushing your bladder out as well, and without, massive tearing. So I just want to throw this out there. So let's go to the next slide here. Okay, I'm going to skim through this because I only was given 30 minutes for this time slot. And this is some important factors though. You want to modify being able to get in and out of a car, get in and out of bed, your sleeping positions, toileting positions, and sitting positions. I briefly mentioned in the previous slide that you want about 2 fist widths between your feet and your knees when you're sitting. No crossing of the legs, because that's going to put asymmetrical stress through the pelvis itself. And then that becomes less ideal for keeping these pelvic muscles balanced internally and externally. We're going to get to that on the next slide. Getting in and out of the car, I like to say that when you see older people in society, a lot of times they're doing this the right way. They sit their butt in the car first, then bring a leg in, and then bring the other leg in. That is the way to do it when you're pregnant. And same thing with getting out of the car. The reason for this is because when we just step into the car and then bring the other leg in, it's going to cause a lot of stress through this pubic bone. So this is one of those things that you can start adapting right away. Getting in and out of bed, we always want to roll to the side first and then get out of bed. When you push yourself up or when you're rolling to your side, you're going to want to control tightening. No, Kano.
You know where my sticky notes are? No.
So my son just joined us, so I'm sorry about that for interrupting here. But the other activity that you want to modify is getting in and out of the car. Getting in and out of bed. So when you lay down at night, you want to always start on your side and then roll to your back to get to the other side, or when you're getting up out of bed, always roll to your side and then come up. When you're doing that, activate that transverse abdominis muscle, pull baby in, and then roll to the side, okay? So those are gonna be really important factors in helping keep diastasis from splitting, okay? The more split we get in the diastasis, the lack of pressure we have there. Also, because the abdominal wall loses its support, our pelvic floor is going to tighten even more to try and give us that stability and support for the abdominal wall. All right. So the other way that people sometimes give themselves a diastasis is by reclining in a chair or on a couch, and they don't even realize that that's actually using quite a bit of ab muscles and then coming up out of it. So when that's the case, just use your arms or your elbows to help lower yourself back or bring yourself up, and that will help as well. All right. Okay, importance of pelvic floor for birth. This is really what I want everybody to know. It's super important. Here is the pelvic floor muscles, okay? There's 3 holes that go through the pelvic floor. We have anus, we have vagina, we have urethra, okay? So urethra where we urinate, vagina is for intercourse or penetrative anything, and then vaginal deliveries, and then anus, right? For bowel movements and bowel function, gas release, all that good stuff. And then we have clitoris, okay? And so I guess I smile when I say clitoris because it feels good, right? So, so as far as pelvic floor is concerned, there are 3 different moves that we need the pelvic floor to be able to do. The pelvic floor has to be able to contract, has to be able to relax, and it has to be able to overstretch. We need the overstretch for childbirth. We need the overstretch for farting. We need the overstretch for bowel movements. I'm saying farting, I guess I should say pass gas, right? However you say it in your house and you feel good with. But the reality is, so many of us, especially during pregnancy, are walking around with these tight pelvic floors. Okay. So we tend to squeeze our butt when we're standing to help support us, or we just hold tension in our pelvic floors. We hold emotion in our pelvic floors. We hold a lot in our pelvic floors. And so it's really important that we work on reversing that movement. And this is why this, you're going to see on the screen these doing these Kegels that were prescribed. This was from a research study. That is not what we teach, okay? Because clinically, yes, that's what the research says, but clinically what we see, it does not help to do Kegels. If we're constantly contracting and our pelvic floors are already in this shortened position and we're not getting to here and or not even close to that overstretch, then doing Kegels is not going to help us, okay? We have to get these muscles the ability to lengthen and then overstretch. A muscle that stays tight and taut oftentimes has the quality of beef jerky and becomes very fibrous, dehydrated, and not a healthy muscle. We want to turn those muscles into a healthy, juicy steak or chicken breast. And that's an analogy, obviously a meat analogy. So I'm sorry for those vegans in the room, but that's the reality of what a healthy muscle needs to be. And it's a lot easier for a baby to get out of a birth canal of a muscle that is healthy and hydrated. And it's a lot less likely that those muscles that are healthy and hydrated will tear. And so I just want to put that out there. It's a really important thing to talk about. The one time that you will be contracting your pelvic floor volitionally, and you might have to train it, is when you go to cough or sneeze, because we don't want that downward pressure of being in a relaxed position. So that will be the time that you go ahead and contract and squeeze pelvic floor. Now, you might be asking me, Dr. Allison, how do you relax your pelvic floor? So I'm going to get into that here. I'm going to go into a little bit more anatomy. This should have been on a previous slide, so I'm sorry for that. But this is that transverse abdominis muscle that you're seeing here. This is the front of the belly. So that's the muscle that often, that can help us prevent that diastasis. So that abs, 6-pack ab separation. We have this diaphragm here. So that's our breath. On the inhale, it descends down into belly. And then here's the pelvic floor. Now, what we want the pelvic floor to do is every time we take a deep breath, so that diaphragm comes down into the belly, we want the pelvic floor to go down as well. So with every inhale, as the pelvic floor goes down, as the diaphragm goes down, the pelvic floor should go down as well. So we're going to start connecting the diaphragmatic breathing to the pelvic floor coming up here. And then I just have some more muscle attachments. Part of really what we specialize in, the method that we specialize in, is really balancing these internal and external pelvic muscles, anything that attaches to the pelvis, to help, because these muscles tend to grip, and as these ligaments get looser, we tend to grip in these muscles to help stabilize the joints during pregnancy. So we work on releasing them, giving them some stability still, but releasing them so that they can be balanced, so baby can just have a straight shoot when they're coming through birth canal. The other thing we work on is really changing the quality of the pelvic floor. So if you're living in that contracted position, really teaching the pelvic floor a new position, and then also teaching it the overstretch position and allowing that to be a normal state for your body and your pelvic floor, because that is what will be healthy. You might be saying, but I'm peeing my pants. I'm weak. I need to be contracted. Well, what we see is that those people that walk around in the contracted position, they are actually kind of worse off, because what happens is the heavier the baby is on the bladder, but this also happens postpartum too, is that when these organs are heavier, and they are, and most of these people that we see that have had children, okay, that their bladders will be below the line of the pelvic floor. So as you go to Kegel and do more contraction, you're actually pushing your bladder out more and decreasing the ability to actually hold your urine. How many of our moms were taught to do Kegels and did their Kegels, but still pee their pants, right? And this is why Kegels is ineffective, and why we really need to be starting from somewhere else. And if you're just, if you haven't been taught to do them properly, or you've just been doing them, you probably need to stop and start doing this relaxation training and training your breath to relax and overstretch your pelvic floor, because that is what is going to help open everything up so baby can get through birth canal. So we're going to talk a little bit right now about connecting our diaphragmatic breath to our pelvic floor. And then we'll talk about how to do that how to have a healthy bowel movement, because it's going to be the same type of breathing. And then we're going to talk about moving that into a visualization to prep for birth. All right. So it's a lot of things on this very blank slide, but hopefully you can see everything as we go here. So first, you're going to take that nice diaphragmatic breath. So let's go back to our belly breath. You're going to take a nice deep breath into belly and let it go. Deep breath into belly and let it go. Now I want you to tune your attention down to your anus or down to your vagina. Okay. On the inhale, I want you to think about opening your anus, or if you have more control at your vulva, go ahead and think about opening vagina. 10 more minutes. So yes, this is real life, being interrupted by your children at home. So, so let's go back to that breath pattern. Deep breath into belly. Think about opening vagina, opening anus. Let it go. Deep breath into belly. Opening vagina, opening anus. Exhale and let it go. As you're preparing for childbirth, one thing that I'll say is inhale and open. And try and keep it open on the exhale. And that can be something that you start to train when you're in labor. You really say, okay, inhale and open. Every contraction, you're trying to maintain this breathing. This type of breathing is also great because it's going to keep you in that more parasympathetic, rest and relax nervous system state. And we want that rest and relax nervous system state because that's going to allow us to be able to have this baby, right? If a tiger was chasing us and we went into our fight or flight sympathetic nervous system response, not only is our pelvic floor going to go like this, but our bodies aren't going to let a baby come out if we have a tiger chasing us. So that's evolutionary helpful, but we need to stay in that place. And so this type of breathing and breath pattern not only helps move baby down into birth canal because your diaphragm is then pushing on your uterus. It's going to help manage the pain from the contractions, or however you want to classify them. We always challenge people to say, maybe it's not pain, and maybe you can classify it as a different analogy in your brain or a different verb in your brain. And so taking those breaths, that's how we're going to have a bowel movement. I'm going to go into the seated position. Now, depending on how big your belly is, and if it's too in the way, a squatty potty might not feel good. But for many, a squatty potty feels really good to have their legs up and then they lean forward. Or you can simply just lean forward. Again, you're going to have to spread your legs and allow belly to kind of hang between them, depending on where you are in your pregnancy. But when you go into that position, you're resting your elbows on your legs. Here, you're going to go back to that breath pattern. You're going to do 3 diaphragmatic breaths into your belly. Think about opening anus, opening vagina. Exhale and let it go. Inhale and open. Exhale and let it go. On the third one, you inhale and open, and you gently bear down like you're trying to fart, but you don't want anyone to see you. So it's not a big push, like, it is just a gentle little, no one can see that I'm farting, So that's the kind of move that we want. You're getting an overstretch, and you're using your breath to get that overstretch, okay? And so when we talk about childbirth, this is the same exact move. Now you might not put, the baby might not come out of your body in this bent over position. It might, but it might not, okay? So you can choose whatever position you want. Oh, hi, Casey. Okay, shut the door. You can go see daddy right now, okay? So it's a half day that I'm recording this. So kids are home from school. So as we talk about birthing and trying to get this baby out of our bodies, we want to think about opening and not holding our breaths, okay? So we're going to use the breath to help guide baby out of body. So you're going to visualize and truly think about this as you're breathing. You're thinking about the diaphragm is in, you're inhaling, the pelvic floor is opening, your diaphragm is inhaling and pushing down on the top of uterus, and then exhale, everything kind of recoils and lets go. Now, when you're ready to push, what you're going to do is you're going to inhale, and at the top of the inhale, you'll initiate your bearing down, you're pushing. And when we do this, we want to do this with an open glottis. So if we had a closed glottis, we would be either breath holding, or if we had a narrowed glottis, we would be talking in really high pitches. If we talk in really high pitches, our pelvic floor is really, really tight, okay? If we talk in low pitches, our pelvic floor opens, okay? So, and if you can't feel any of that, one thing you can do is practice in your bed. Stick a finger inside the vulva, inside vagina, and see if you can feel the different positions. The more closed is going to be those narrow glottis and higher pitch voices. The more open and deeper you can get is those deeper glottis. The more open glottis position. And so when you're laboring and when you start to push, it is those deeper tones that are going to be really helpful in opening pelvic floor and allowing baby to come out with more ease. So here is an initial push. Okay, so we're going to inhale. Imagine we're with a contraction right now. Exhale and letting it go. Inhaling through the whole contraction. And when you're ready to bear down, you're going to bear down at the top of the inhale. So you're going to inhale and bear down that way. Okay, so you're still breathing. There is still an exchange of breath. You are not breath holding, because that's going to put a lot more increased pressure, and it's going to increase your risk of damage to the whole perineum itself. So hopefully that is helpful. And if you have any questions, you can let us know. But that is how you'll move into how to push. Okay. So we talked about a bowel movement, because bowel movements happen every day, or at least they should be happening every day. If they're not, definitely come see us. But if they are happening every day, it is your opportunity essentially every single day to prepare to push. So when you're sitting on the toilet, use this type of breathing, which you're going to have to dedicate yourself to, because a lot of times we just want to poop and go and we don't take the time to sit down and breathe on the toilet. So allow yourself to sit down and breathe. Visualize being in labor and visualize that baby coming through your vaginal opening. Imagine if your baby has hair, is bald, whatever, just visualize it, because then you're creating a mental map within your brain of that baby coming through birth canal. So that, and you get to do that every single day of your pregnancy, or every single bowel movement during your pregnancy. All right. So, perineal stretching can help the pelvic floor prevent tearing. So perineal stretching happens within this first layer of the pelvic floor. It's right inside the vagina. So if I just put my very first bone of my finger, the digit, inside the vagina, that would be that first layer. Okay. The pelvic floor has 3 layers though. So a lot of times this is why the research doesn't actually show that perineal stretching helps prevent tearing, is because it's only dealing with this first layer. So one of the things that we really see during pregnancy, and why it's so essential, not just to have, some physical therapists will do biofeedback on the pelvic floor to see, is it contracted? Is it relaxed? What's happening with these little electrodes? But, and I did that very back in the day, but that's pretty archaic at this point, because we need to see what all 3 layers of the muscle are doing and what the quality of those muscles are. And I know that people will say, well, the biofeedback is picking up those 3rd layers, but really it's not showing us what the quality is. When we do these exams on anyone who's pregnant, what we often see is this tightness. But if this is the vagina and we want it to be a straight shoot, essentially, so if you think about I was thinking about a vagina laying down, but let's pretend it's standing up. What we see happening is that there's this big kink in the 3rd layer. So this 3rd layer tends to be very elevated because it's holding on to and squeezing everything, keeping the baby in, keeping the pelvis together, right? So it's working really hard. What we need to do is help overstretch those 3rd layer muscles and balance all these internal muscles so baby has a straight shoot. And that's really where the magic is. If you're thinking, how can I do that myself? It's challenging, and I would always say get guidance from a pelvic expert physical therapist, or someone who does this on a daily basis, which is what we do at our office. So come in for a consultation and we can really talk about what's right for your body. A lot of PTs will not do internal work or consistent third layer work. And so, which is a total bummer, but this is what needs to happen in order to help improve the length of these third layer muscles. And this is what's going to give you that control to breathe your baby out. If you've been through this whole lecture and you're like, I can't feel myself connecting to my pelvic floor, perfect. That is the time that either A, spend some time in the privacy of your home. And if you're comfortable touching your own vulva, learn how to open vagina, learn how to close it with a Kegel so you can get connected. But if you're not feeling that and you're not having good control, then I highly recommend you come in for a discovery visit and an evaluation. And that is going to help the baby come out. So to answer this question, is perineal stretching helpful in preventing tearing? It can be, but truly the magic happens when you're addressing all the muscles, not just this random first layer. So different exercises. The number 3 things I hope you get from this is the diaphragmatic breathing, learning how to engage your transverse abdominis to activate that wall of your abdomen. And then third is those bowel movements, because if you can really breathe your poop out, you are going to be able to breathe your baby out. And the 4th thing is, of course, come see us, and that we can help you open up your pelvic floors and really get you connected. It doesn't mean that these muscles are gonna, your baby's just gonna fall out because you're so wide open. Hopefully it does during labor, right? And some people tell us like they're concerned, like they're actually really weak. That's why they're peeing, and they need to really strengthen. And this is how you get stronger. So if a muscle can get to this resting position, then every exercise and activity you do actually does cause contraction of the pelvic floor. And you don't need to consciously think of it all the time. Okay. So, but if your body has to be able to get here first in order for those moves to be helpful in strengthening your pelvic floor. So, birth rituals, and then so 5 minutes of breathing is the other ritual I'd love you to do. So focusing on your bowel movements, focusing on 5 minutes of breathing a day, focusing on that 10 contractions for 10 seconds of the abdominal wall, still while breathing. And then also seeing a pelvic expert PT who is really going to specialize in these types of protocols that we are pioneering at Body Motion. Pilates, yoga, boot camp, CrossFit, these can all be really safe. And really great. Just you want to make sure that you're activating your core when you're doing these so that these exercises are helpful for you and not hurting you. Normal healing times postpartum are, that 6-week mark, 8-week mark. It just means that you're not bleeding anymore and your uterus has healed the wound, right? And so, I would just highly recommend working with a pelvic expert PT, someone who understands what your core has just been through and can really help guide you on your path to strengthening. So anyone can benefit from this work prenatally. The birth prep stuff is a lot more than just prenatal PT. It is a method, and it's a method that we're actually in the process of trademarking at Body Motion. And so, but if you are having any of these symptoms at all, we highly recommend you get some help for them. And it means probably that your pelvic floor is really tight. And so you should definitely get help. So you not only help these issues, but you help your pelvic floor. We also offer an online birth prep program, and we have it on sale today. So thank you for being here, and we look forward to getting to know you. Take care.